Perfect. Wonderful, wonderful. Okay, so I guess we'll go ahead and get started today. I know I'm a little bit of a different face than what you had last time. You had Kayla joining you last time. So my name is Shauna Pelly, and I am the Capacity Building Programs Director with Fuse Social, and I'll be with you guys for the remainder of the Disaster Risk Reduction series. So yeah, let's just dive on in. So I'd like to start with our land acknowledgement. Fuse Social acknowledges that for those who are in Wood Buffalo, which our meeting is being held on Treaty 8 territory, ancestral and traditional lands of the Cree, Dene, and the unceded territory of the Métis people. Their footsteps were the first to walk on this great land that we now call home, and I acknowledge that they welcomed and shared this nation with us. So just a few Zoom housekeeping. So you are in a webinar format in Zoom, so we can't see you. So if you do have a question or if anything pops up, please feel free to raise your hand or make a comment in the chat, and I will monitor that throughout our session today. And then I would like to pass it off to Sarah Walsh, and she is the Disaster Risk Reduction Manager for the Canadian Red Cross, and she will give you an overview of our day. Thank you.
Excellent, thank you. I'm just going to share my screen. Okay, and boom. You can see that okay? Okay, great. So yes, as Shauna said, I'm part of the organizing committee for this initiative. I'm joined, I work closely with Fuse Social and also with our partner at the Resilience Institute, so Laura and Brooklyn. You'll get to know Laura more in the next speaker series, in the next speaker section in November, as she'll be kind of hosting and facilitating it. But I just wanted to welcome everyone and to say how exciting it is that we're here on October 13th, because it is International Day for Disaster Risk Reduction. So this was purposely designed to happen on this day to recognize something that I'm quite passionate about, which is disaster risk reduction. And it's such an important day because it really is about building awareness of what risk reduction is all about. You know, if you were in our last speaker series session with David Alexander, he really kind of set us up for acknowledging that the way forward is a risk reduction approach. But so much of our response to disasters and hazards is exactly that, is through response and recovery. So, International Day of Disaster Risk Reduction is about promoting and building that awareness of the impact that we can make if we sort of, take our stop merely just responding to disasters, but invest in all the things we can do before they impact the community. So that's looking at who's most at risk and reducing vulnerabilities and things like that, of which the social profit sector plays such a key role in. So anyway, best day of the year, International Day for Disaster Risk Reduction. And I'm so excited to be sharing this time together with you as community-based organizations. The other thing I just wanted to really quickly highlight, and in our intro, the end of September with Professor David Alexander, I don't think we really kind of laid out how the whole initiative is being conceived and some of the objectives. So it's not just about hosting speakers. We also have some support workshops being planned also into 2022. So there's kind of three pillars to this initiative. One is to raise awareness about what we're talking about when we talk about DRR, disaster risk reduction. And that will be the speaker series that will be ongoing from September until pretty much the end of May. Some future discussions, I'll talk more about what's going to happen in 2021, but into 2022, some of the themes that we'll have speakers present on are health and social vulnerability, diversity and inclusion planning, Indigenous approaches to disaster risk reduction, and then we'll come together and kind of look at, okay, so what's next? We have this awareness now. What can we do to move this forward? The other component is the other pillar is to support capacity building within the social profit sector. So some of the things we have planned is on November 4th, and I'll talk more about this in another slide, but we have a workshop on where and how social profits can find that information. Yes, and then of course, into 2022, some hands-on workshops, particularly around service continuity planning, and some other aspects. So how social profits can integrate this risk reduction work into everyday operations is kind of the key there. And then the third pillar is on reaching those who are most at risk, and that work will take place with the Resilience Institute and the Fire and Ice program that we have there. So more to come on all of these aspects. Hopefully by November, we'll have the schedule set for 2022. And so all of this work together will will come together at the end and recognize disaster risk reduction champions. So we're aiming for social profits that are able to participate to be recognized as DRR champions. And we have a small committee looking at how we can make that recognition happen. Yeah, so there'll be some celebration around that. We'll come together as a community, and hopefully that we will be able to come together in person, and we're looking for June 2022 for that to happen. So just recognizing our achievements. And I just wanted to highlight the rest of the project sessions that are going to happen in 2021. So the first one that I briefly mentioned is a workshop on accessing hazard information and basic data creation. So that will be November 4th from 9 to 10:30. And what this is all about, I'll just read the synopsis. So as part of the Social Profit Disaster Risk Reduction Project, the Canadian Red Cross is inviting participants to a virtual interactive session to explore mapping tools and information to better understand localized hazards and risks. The session will introduce social profit participants to available maps and data related to current and historic natural hazards, as well as demographic information to inform planning and programming decisions at the community level. So we'll be looking at what's accessible here in Alberta. So the provincial data, some local data, and kind of just bring it all together. And this ties so nicely with what our speaker today will talk about, which is about hazard mitigation and understanding the risks and things like that. So this is kind of a companion workshop to what our speaker will present on today. And then in November 18th, we have Understanding Climate Change Risk and Vulnerability. And that will be a speaker session with Dr. David Sachin, who is director of the Prairie Adaptation Research Collaborative and is kind of the lead author on some of the key reports coming out on climate change in Canada. And then we have Mr. Kevin Blanchard joining us from London, and he's the lead on the No Natural Disaster Global Campaign. So that will be, I think, pretty interesting to introduce to our community here in RMWB. So that being said, it's now my absolute pleasure to introduce our guest speaker for today. And let me just give you a little bit of a synopsis on her background. So Dr. Alessandra Jerolleman is Associate Professor in Jacksonville State University's Emergency Management Department. She's a community resilience specialist and applied researcher at the Lowlander Center, as well as co-founder of Hazard Resilience, a United States-based consultancy. Sorry, my screen just went black. Wait. Okay, we're back. Yes, so she's co-founder of Hazard Resilience, a United States-based consultancy providing leadership and expertise in disaster recovery, risk reduction, and hazard policy. She recently published a book titled Disaster Recovery Through the Lens of Justice. Dr. Jerolleman is one of the founders of the Natural Hazard Mitigation Association and served as its executive director for its first 7 years. Dr. Jerolleman is a subject matter expert in climate adaptation, hazard mitigation, disaster recovery, and resilience, with a long history of working in public, private, and nonprofit sectors. She's involved in various aspects of planning and policy and at the national and local level, including participation in several workshops each year. She speaks on many topics, including just recovery, hazard mitigation and climate change, campus planning, threat, hazard, and vulnerability assessments, hazard mitigation planning, protecting children in disasters, and public-private partnerships. So I'm just so excited to welcome Dr. Jerolleman to Fort McMurray and to Alberta, the province of Alberta. I also just want to recognize that she's been heavily involved in the recovery efforts of a category for Hurricane Ida, which struck Louisiana in August, the end of August, so most recent. So I really, really appreciate the time that you can come and take to share your experiences with us here. And I think we're gonna have a lot to learn. So anyway, please welcome Alessandra. Thank you so much for joining us.
Hi, and thank you for having me. Let me go ahead and share my screen so that folks can see my slides. Are you able to see my screen?
Yeah, it looks great.
Fantastic. Thank you. And thank you for the introduction, and thank you for the invitation. It's really great to be here today, everyone. As Sarah mentioned, I think much of my work is in the United States context. So you'll have to pardon me if I use slightly different terminology in some cases. And much of my work has also been with very small profit or nonprofit organizations in the US, and many of them don't see themselves as actually having the bandwidth or the time to engage in disaster risk reduction, at least not beyond the work that they already do in their primary mission space, which is very often disaster risk reduction of its own kind, or at least risk reduction of its own kind, right? Dealing with a lot of these systemic challenges and issues that are in all of our communities, whether we are in the US and Canada or elsewhere. I hope that I can give you some ideas and maybe some tools, maybe some small manageable activities, things that can be done, because I know that disaster risk reduction is really daunting. And finally, I just want to say I'm speaking to you from New Orleans here in Louisiana, and it's land of the Ataka and Chitimacha people. There are a few places in this presentation where I am really hoping that you will chime in using the chat function and share some of your thoughts and your experiences. I think that'll be much more interesting than anybody just having to listen to me drone on. But the main things that I want to talk about today, I hope will build on heard in the last presentation. First, what is resilience? What do we mean when we talk about resilience? A little bit about how you might understand hazards and risks, the role of the social profit sector, not just in disaster risk reduction, but also really thinking about hazards and risks more broadly. a little bit about continuity of service provision and disaster planning. Again, some of those things that you can do, and then some additional considerations where I'll talk a little bit about hazard mitigation, a few other things as well. And then I have a few links to resources to share. But again, I'm sure that you know of other resources that I don't. And it also sounds like you've got a really wonderful series of events coming up that will get you kind of hands-on interactions with some of these things. So my first question to everyone that I hope, again, some folks will answer in the chat is, what on earth comes to mind to you when you hear the word resilience? See strength pop up in the chat, recovering, being adaptable. Does anybody have any negative connotations for resilience? Ability to adapt and move forward. Okay. You know, I think this is one of these terms that gets used a great deal. It doesn't always get very carefully or closely defined. And you're all pointing to some very important elements of the concept: strong social networks. You know, one thing that I have found in talking about resilience with some environmental justice communities, so communities where there's really a lot of negative health pressures and environmental pressures, is I've had community members actually push back on the concept. Exactly what I'm seeing in the chat now, that it can sort of undermine the ongoing hits, as is being put. I had an organizer tell me once that resilience just means that no matter how many times you punch me in the face, I'm going to get back up. And it never means that you have to stop punching me in the face. And that really resonated with me. So I think it's an important concept. I also think it's so important to ask who we're being asked to be resilient and sort of at what cost. So I did want to just share that with you. And thanks for participating in the chat. So for the purposes of today's discussion, I did want to have, you know, a definition to go from, and there are several that could be used. But so I took the definition that's in the Emergency Management Framework for Canada from 2017. And that framework defines resilience as the capacity of a system, community, or society to adapt to disturbances resulting from hazards by persevering, recuperating, or changing to reach and maintain an acceptable level of functioning. This definition really does, to me, to seem to encompass a lot of what you shared in the chat: ideas around strength, ideas around adaptation. It's not uncommon in definitions of resilience to see this focus on an element of change or growth. It's also very common to see definitions look at resilience not just as an individual quality, think of, for example, psychological resilience, but also as an organizational quality or a societal quality. And one thing that I system, because by definition, that means that we all have to work together towards it, right? It means that perhaps resilience is not something that can be achieved entirely independently, which I also think makes it really exciting to see folks coming together for these kinds of discussions. And resilience is also a strengths-based concept. We have a tendency in risk reduction and to achieve resiliency. Because even in vulnerable communities, there are areas of strength, whether that comes from historical knowledge, whether that comes from social networking, practices of self-reliance. There are many places where that can come from, but that resilience is always there. And it's easier to be in partnership with community when we can recognize some of those strengths and not solely come at this from the perspective of deficits. So the next question that I am hoping that you will help me answer is, where can you go for information about hazards and risks. And I'm hoping that you'll use the chat. The workshop, absolutely. Okay. Emergency response plans. Formal channels, okay. Let me ask you something. So I feel like I'm getting a little bit of the school answer. So local knowledge, and generally speaking, most of us start with each other. We start with our experiences. We start with what our colleagues and friends and families are aware of. We have a sort of baseline understanding of some hazards and risks. And then perhaps we seek more formal sources. But I think it is certainly the case, especially for sort of your average individual, that they're going to multiple places for this kind of information. And they're not always going to the official channels for this kind of information. What I'm going to share with you is one of the official channels, and I'm excited that you're going to get a workshop to do more of this. And that is the Canadian Disaster Database that Public Safety Canada has. It may well be that you're all familiar with this. The link is at the end in the references. You can search by time period, you can search by province, you can search by disaster type, and you can get both this map view. I put a picture in here and you can't really see the bottom, but there's actually a description of the event and the damages. And you can also just get a spreadsheet. And so this is a tool just to understand the history of events in an area, the frequency of events in an area. This can supplement what you know from local knowledge. It is certainly the case here in the US, and I'm certain in Canada as well, that what gets recorded and captured doesn't always encompass the totality of the events that do in fact happen. And the monetary damage costs that can be assessed are going to be very much limited to what is perhaps more tangible and measurable. So thinking about assessing the costs of damages to structures or infrastructure. In some cases, there's quantification of lives lost, or economic impacts. But that doesn't really capture the impacts to the social fabric. It doesn't capture the impacts to children and families, the impacts in terms of trauma. And so it's going to be a little bit limited, and it might overinflate some hazards and perhaps draw insufficient attention to others. From, again, these sort of more formal sources, I took a look to see what hazards were identified for the regional municipality of Wood Buffalo. And the hazards are here: floods, power and water outages, severe storms and weather, which includes ice storms, tornadoes, thunderstorms, blizzards, and winter storms, and wildfire. But I would suggest that there's actually a lot more risks than these, a lot more hazards than these. There are a lot of day-to-day stressors that people experience, challenges within the community, and perhaps unequal access to employment, need for particular social services, need for health services, the impacts of COVID-19, the impacts of industry. There are a lot of many other impacts that have that touch people very directly, right? And I think it's difficult to talk about disaster risk reduction and really limit it just to these sort of more official hazards, because there's a constant interplay that's happening. There's a constant piling on where individuals and organizations aren't dealing with any one of these things in isolation, right? So you might approach flood season as the ice is breaking up and be concerned about flooding, but that might not be the most pressing concern because there are day-to-day needs just for basic livelihood needs and necessities. And so I think it's important not to be blind to that when we sort of think about hazards, because again, none of these happens entirely in isolation. And the resiliency that people have and organizations have to meet the challenges that these hazards bring is directly impacted by everything else that's happening, right? Where resources are having to go, where there are needs, where there are vulnerabilities. So then thinking about analyzing risk, and again, often in emergency management, we talk about this in very dry terms. We talk about this in scientific terms, or at least quasi-scientific, because our data is not always fantastic. But we talk about risk in a very dispassionate way that I think doesn't take into account that larger context that surrounds all of these risks. So I would suggest that you can think about this kind of framing, you can think about this kind of risk analysis, certainly for the recognized hazards, but you can also apply some of this thinking to other day-to-day stressors. And I would also suggest that to some extent, all social profit organizations work in response in one way or another, okay? Because you're often working to meet some kind of social need, including cultural needs, including a wide array of needs, but that all come into this nexus with vulnerability and resilience that's then going to interact with a hazard when it does happen. So just a minute on these terms. The first is likelihood and frequency. So typically an analysis of risk is going to consider how often something is likely to occur. There's very good data for some hazards. There's not as great data for others. Okay, so if you take pandemics, for example, roughly speaking, we know that we've seen them on about 100-year intervals. That doesn't hold entirely true. That's not a planning assumption that you can really use. Earthquakes, it's also quite difficult. Flooding, though, we tend to be able to see, especially when it's seasonal, right? Some patterns, those may be changing with climate and other impacts. But we can see some patterns, we can make predictions. We know that certain hazards are much more frequent. It would seem likely that in any given year, we'll see thunderstorms, right? And so in thinking about risk, it's important to think first about how often an event can occur. Now, this isn't very cut and dry though, because it's not enough to say, okay, I'm going to plan for the most frequent events. You also want to take into account the magnitude of the event, the kinds of impacts that the event is likely to have. And so a very frequent event, but that has a very low magnitude, has very limited consequences, might not be where you put time and energy. Okay, I'll give you a local example for me. Here in New Orleans, we see a lot of localized minor street flooding, not enough to get into houses, enough to occasionally damage a vehicle. And that happens from rainfall, and it happens from backups in the drainage system. Okay? And so that is a pretty low magnitude event. The dollar damages are low. The inconvenience is high. Maybe the psychological toll of it happening repeatedly is high, but the magnitude is low. But then you also want to ask, what are the available actions? What is it that the government can do? What is it that individuals can do, or business owners can do, or leaders of organizations can do? And that's also going to have an impact here. So let's take, for example, wildfire. There are in fact some smaller, lower cost actions, fire smart kind of landscaping actions and things like that, that might have an impact, right? On the other hand, if we're thinking about perhaps more catastrophic flooding, then there's a lot less than can be done. And so in the end, the calculus for any given hazard is the interplay of these three things. And some people will actually do more formal risk assessments where you can actually try to sort of quantify and build a matrix, but it comes down to, in many ways, a really basic question. Are there rare but very catastrophic events that maybe there are small things we can do now so that if they happen, we can minimize the impacts a bit? That's sometimes where you get into things like evacuation planning, right? That might also be where you get into thinking about some basic things around continuity, basic things around public education, right? Relatively low cost activities that have some measure of an impact, even if the event doesn't happen frequently or doesn't happen in the next decade. You also have events that are going to be a lot more frequent, but the impacts are pretty low, and maybe there are some easy available actions. Those might be reasonable to take. You might also have frequent events with moderate to high impacts, but no available actions, right? And so you consider all of these things in trying to sort of understand not just what risks you need to be most concerned about, but if you're making decisions around resource allocation and your time is a resource, right? Your energy is a resource. You're here instead of doing other things, then it's important to ask all of these questions, because it is also very easy to try to address risks based off of what's happening around you. Maybe you've been receiving information about a particular hazard, or maybe a particular event happened recently, right? And that may not reflect the actual best or wisest use of limited resources. Some of the things that you want to think about in terms of impacts, you want to think about what are the impacts to the populations that you serve? What are the impacts to your operations? What are the impacts to structures, equipment, infrastructure? And this doesn't just have to be things that you own or operate, could be things that you rely on, partner organizations where you use space, for example. And then also impacts to the mission. And the impacts to the mission from hazards, they can be pretty wide ranging. And some organizations find their day-to-day activities really just overtaken by the need to respond and then work on recovery. And that can detract from a larger mission that the organization has, which is also very important. I was going to ask you about your relationship with local emergency managers or public safety officials, if you sort of knew who to call. I noticed in the chat earlier that some folks did refer to local websites, but I'd be curious to know, generally speaking, are you able to just pick up the phone and talk to somebody who can help you understand risks, or somebody that you can ask when there's a wildfire if you should be concerned? This may be a silence that I interpret as maybe no. Okay, yes, informally, no immediate person to call. Okay. It seems like there's a pretty wide array. And one thing I would say is, even if you don't directly have those contacts or those relationships, if people in your network have them, right, that's also a route to that information. And I'll talk about that in a minute, but the idea that really building resilience requires a lot of collaboration, because no one organization typically, unless it's your mission, right? Red Cross, for example, but no one organization is necessarily going to have the time to engage in every planning process, to build and sustain and maintain a relationship with local folks in public safety. And so it becomes really important to think as a network, right? How can you collectively access information that you need using the existing relationships that are in place? Another thing that I wanted to say, and it sounds like you're going to hear more about this later, but I just wanted to make the statement that there's no such thing as a natural disaster. There are just natural hazards. Disasters aren't really just a natural physical process or an event. Vulnerable people have to be exposed, right? And vulnerability is situational. It's not a permanent characteristic. Social political processes impact vulnerability, and institutional policies can either increase vulnerability or they can build resilience, or in actuality, some mix of the two, right? And so anytime there's a disaster, it's not just the natural event that's happened. It's the people, the processes, the structures that were in the way, right? And so it makes it very complicated to think about hazards and disasters, because we have to take so much more into account than that really technical framing of how often and at what magnitude. But it also means that disaster recovery can present a big opportunity for disaster risk reduction, not just at the level of an individual, a household, or an organization, but also at the level of a society. Because a disaster often brings to light the many other social and institutional processes that are creating the risk and the vulnerability. And so I bring this up for one other reason, which is I think the role of the social profit sector is already so intricately connected to the different variables and factors that interact with natural hazards to create disasters. I borrowed this from a report by Fuse Social from a March 2021 survey of social profit sector organizations in Wood Buffalo. And I just wanted to show, based on that survey, the types of focus that organizations have. And for any one of these, I would say that there's a clear nexus to what happens in disasters, what happens in disaster recovery. So it may not be a primary mission space, but it's certainly there. It's certainly ancillary. And 69% of active organizations that were surveyed in March of 2021 were providing services directly to residents. So that also means, I would say, two things. First, that your organizations are building the capacity and the resilience of residents, which is really important to thinking about disaster risk reduction, but also that you're directly serving a population that's going to have more needs after an event, right? Because again, there's going to be that interplay between the existing underlying needs and what happens in the actual disaster. And thank you for the point in the chat. Absolutely, we are in a disaster, we're in a pandemic, and we have been in back-to-back and concurrent events for a really long time now. I think in many places, you could actually trace that back to even before the pandemic, where communities were still recovering from floods, from fires, from other events, and then the pandemic on top, right? Which has been a very long duration event and is by no means over yet. And all of these stressors play a role. I actually have a few slides later on the impacts that COVID-19 has had on the social profit sector, because again, I think it's very important to keep that context in mind. So continuing to think about the role of the social profit sector in disaster risk reduction, not just for itself, not just the organizations, but also for the broader community and the people that are served, I wanted to share two quotes that to me really just come to saying, in part, just keep doing what you're doing, right? There is certainly a lot of important and valuable work that is happening. And the first is a quote from a recent article by Ben Wisner. And he wrote that the reduction of loss, injury, and death from natural hazards requires a comprehensive whole society approach that engages all domains that touch people's lives: education, healthcare, food and nutrition, and so on. That looks an awful lot like the list of focus areas that I just showed on the last slide. And second, from the Emergency Management Framework for Canada, resilient capacity is built through a process of empowering citizens, responders, organizations, communities, governments, systems, and society to share the responsibility to keep hazards from becoming disasters. I think it's really important to keep in mind this idea of lifting up and empowering citizens and organizations, because a more prepared, more resilient population is going to be more able to withstand the impacts of a disaster. And so we can talk about disaster risk reduction, and we can talk about that in terms of concrete things that you can do for continuity of operation, and we'll do that in a little bit, to buildings and structures. We can talk about hazard mitigation. But at the end of the day, there's a lot of individual citizen level capacity building that is key, and that not many other sectors are positioned to provide. Another note on resilience, and this also comes from the Emergency Management Framework for Canada. I just wanted to point out this focus here is on the members of resilient communities, and it's on empowerment and education, right? And these are all, I think, places where the social profit sector already plays a role and can continue to do so. So the first is that members of resilient communities are empowered to use existing skills, knowledge, and resources to prevent, mitigate, prepare for, respond to, and recover from disasters. They're able to adapt their everyday skills and use them in extraordinary circumstances. The second is members of resilient communities are educated on the risks that might affect them, and they understand the links between the risks assessed and their own lives and business and local environment. And the third is that members of resilient communities are engaged in the community, adopting a long-term holistic and community reflective perspective, influencing and making decisions to address the needs of the community. This is the social connectivity that breeds social capital and also political capital. And it's a space where social profit organizations often play a role. And finally, resilient communities encourage trusted champions to communicate the benefits of resilience to the wider community and influence others. And these champions can be individuals in the community, they can be local officials, they can be your own volunteers or leadership, right? But having people in the community that are trusted and that are speaking about these things is tremendously important. And that takes me to the last point that I wanted to make in this section, which is about collaboration. Every organization, I am sure, at least every organization I have ever spoken to or been involved with, is strained to capacity, right? Providing the most services possible, the most people possible, in the best way possible with the insufficient resources, no matter what. There's always more need than there is resources. And that means that in order to put any time and energy into something else, because no matter how much I've stressed that thinking about resilience and thinking about disasters should be part of day-to-day efforts and is intricately connected to missions, at the end of the day, you have a certain amount of time in a day and you've probably already just about filled it, right? And so if you're really going to put some time and attention into thinking about disaster risk reduction, into thinking about hazards, I would argue that generally speaking, it has to be a collective endeavor because you can help each other. You can help each other build programming. You can help each other find solutions to thorny problems. You can help each other share and disseminate information to the populations you work with. You can help each other have linkages back to government organizations and sources of data and other institutions, right? Because on your own, it's very difficult for any one organization to really do this. But collaboration is difficult. And I think that's something that we don't often tend to talk about. Social profit sector organizations can be pretty good at it. But at the end of the day, collaborations are sometimes frustrating. Not everybody shows up. Not everybody shows up equally. Not everybody brings the same level of resources. There can be interpersonal challenges. There can actually be some pretty fundamental normative differences, right, in understandings of particular needs, approaches to mission, and so on. And there's a really good article, I'm happy to share it if anybody would like, about collaborations and how to make them successful. And these researchers in public administration, what they did is they surveyed a lot of collaborative endeavors, primarily in the US and primarily around natural resources. They looked to see which were really categorized as being successful. And what they found was actually that the vast majority of collaborations weren't successful. They didn't last very long and they didn't do what they were intended to do. And there were a lot of reasons for that. And so they came up with these key suggestions that I think are worth sharing. The first is that there needs to be a clear advantage for all parties. Right? There needs to be a reason to be at the table. And the second is that we need to understand collaborations as being very complex and dynamic, not just between organizations, but between individuals. And those relationships and the needs can change pretty drastically over time. That we need to take a really active design approach. In other words, we need to actually put the time into building it. We need organizational structure, as terrible as that sounds. It's not enough to just sort of show up at the same table, and because it may not be the right people, or half of us may be on our phones and answering emails and dealing with emergencies, right? We also really need to have committed sponsors and champions and facilitators. And this includes being able to really put in the time, right? Not just to the actual sort of quote unquote business of a collaboration, but to the relationship building that makes a collaboration really work and be sustainable into the future. And using inclusive processes to develop inclusive structures. And this can also mean really acknowledging that there are already power differentials, usually walking into the room. It's very rare that every organization in a collaboration has sort of equal clout, right? Some organizations are larger than others. Some have been around longer than others. Some are more politically connected than others, right? And that may vary from organization to organization. Some are already really used to working with each other. Others are not. All of those things come into play. And also the importance of flexible governance structures. So the next thing then, I just wanted to talk for a minute about sort of the current state of the social profit sector. I mentioned that I was going to share a little bit of data about COVID-19 and what's been happening with the sector, but I'd love to hear from you first. I mean, how would you describe the current state of the social profit sector? You can answer this from a very local perspective, or you're also welcome to really answer this from a much more global perspective. Tired? Burned out? Treading water, yeah. Under-resourced. I hear and feel all of those things, especially with Hurricane Ida and competing, right? Some collaboration. You know, one of the things that has been a trend in the US, even prior to COVID, is we saw actually pretty substantial impacts to the nonprofit sector from the 2018 recession that really drove up need, drove down resources coming in, and also, I think in some ways, drove increased government pressures to essentially punt certain things to the nonprofit sector, to say, you know, local government is too taxed, we can't meet these needs, the nonprofits will do it with or without resources, right? And that pool of the nonprofits will do it seems to kind of get bigger, even as the resources get smaller. And so that is very challenging, and it is very daunting. And I didn't ask that question to sort of bring us all down, and I hope we'll end on a higher note than that. But I think it is important to acknowledge that the social profit sector is really dealing with a lot, right? And this is a result in many ways, actually, very adaptable and very flexible. I mean, we are used to cobbling things together. We are used to making do, but making do doesn't necessarily meet all of the needs, and making do doesn't necessarily leave space for resilience. So it is a big challenge that goes beyond the sector, right? I think it also speaks to advocacy for the sector. It also speaks to trying to increase government and societal understanding of the role that the sector is being asked to play and the resources that it's being given. I looked at two research studies that were done in 2020 on the impacts of COVID-19 on the social profit sector in Canada. And one was done by Imagine Canada, and the other was done by the Alberta Nonprofit Network. And to be honest, I'm not 100% certain if the Alberta Nonprofit Network survey was limited to Alberta or was Canada-wide. But what the surveys showed is almost verbatim what the surveys in the US showed. Declines in revenue, necessary and kind of resulting reductions in paid staff and volunteers. Some of that tied to declines in revenue, some of that tied to COVID risk. Our volunteer base has often been comprised of, at least in the US, older folks who perhaps are more at risk. Increased demand for services and for a wider array of services. In 2020, over 75% of the respondents reported needing emergency funding just to remain operational, and reported a lot of pessimism. Okay? So it is in some ways a difficult time for the sector. In other ways, perhaps there is an opportunity in that the needs that the sector fills are rendered so very visible. I also wanted to share with you a little bit of data, again, from Fuse Social, thank you, from a survey in 2016, where 75% of the organizations surveyed had been impacted by losses of board, staff, and volunteers. 1 in 3 had building damage, 1 in 5 had equipment damage, and 1 in 10 lost data. Okay? So this is very real. Disasters are going to impact operations, and perhaps the best we can do is plan for them as best we can. But I would suggest that it's really important right now because we already are operating with a very small buffer, if any, right? The sector is already very stressed. And although that does make it harder, perhaps, to put time and energy into disaster risk reduction, in other ways, it makes it pretty imperative for the sake of survival. So I would like to talk for a minute about continuity plans. And I want to say there are a lot of ways to think about continuity planning. Sometimes it's very focused on service provision. Sometimes it's essentially private sector business continuity that's sort of slightly tweaked to work more for the social profit sector. And often it's daunting. Larger organizations have emergency managers or risk managers, right? They may have some pretty elaborate planning mechanisms in place. And a lot of the tools that are available for organizations to use make some pretty big assumptions about the size and the scale and the scope of the organization. What I've tried to do is really reduce this to some very basic questions that you can ask in or out of a planning process, right? These can be monthly conversations over coffee where you devote just half an hour to asking one question out of these, probably 30 questions. And at the end of a year, at the end of 2 years, you're much further along than where you started, right? And so I would definitely suggest if you leave this webinar with nothing else, that you really think about some of those baby steps that you can take because they do add up over time. So let me ask you again, if you don't mind chiming in the chat, who has continuity plans in place? Okay, it's a goal. Okay, one program does. It's very common for me in rooms similar to this one, virtual or real, to get exactly these answers. Either no, or we really want to, but we haven't done it yet, or we did it a long time ago and haven't looked at it again. Because it is difficult and it is time consuming, and there isn't necessarily a lot of help for it, right? And I don't ask this question to pass judgment or make anybody feel bad that they do or don't. In part, I think ask it so that folks can see that to some extent you're in the same or very similar boats. There are elements of continuity planning that you can do together. There are elements that can be worked on collaboratively. There are resources that can be shared, information that can be shared. As was pointed out in the chat, maybe you have some natural partners in this room. So if that sort of helps to make it a little less daunting. But sometimes there are some very basic practices that can be taken on that can make a world of difference. Something as simple as an executive director grabbing the checkbook on the way out the door if there's an evacuation that might last for more than a day or two. So there are easier, more manageable chunks. And I hope that this list of questions I'm going to share with you feels manageable. I guess only you will know. So the primary goal of continuity planning, business continuity planning in general, is to make sure that key operations can continue immediately following a disaster. And you could amend this to say during, but in truth, for many kinds of hazards, there's a moment in time when you're not going to be operational, right? And I think it is always important to really prioritize life safety above the organization's documents, facilities, all of those things. But generally speaking, the goal is to minimize the length of a disruption for many reasons. One is to continue providing really needed services to a population that maybe needs them more. Another is to be able to capitalize on resources that become available in a very small window, right? When you get a large event, I'll use Hurricane Ida, for example. There was a window of about 5 or 6 days after landfall when a lot of organizations wanted to make small grants, $10,000, $15,000 grants to the tribal organizations down the bayou that I work with. And they were very frustrated because they couldn't get in touch with those organizations because their houses were leveled and there was no water, no electricity, no cell phone service. I mean, there were many, many reasons why they couldn't get in touch, and perhaps no continuity plan would have resolved that. But that is a window in time where whatever you can do to retain some measure of even reduced operations can pay big dividends. And in one of the small tribes, the Pointe-au-Chien Indian tribe, they actually had a tribal member out of state that had been previously appointed to be the point person. So she, because she's in Arizona, was still able to get phone calls, was able to make some of those donations happen. So that's sort of one example of the value of this. It's also really important for ensuring continuity of the mission and taking care of your own staff. If you're an organization that gives money, sometimes grantees, so there are a lot of reasons to think about this. So these next few slides, what they do is they go down sort of different areas that are typically included in these kinds of plans. And I'll share with you what those are, and then maybe we'll just talk through a few of these questions. The first is key tasks and functions. So really, what do we do? What do we always need to do? One of the easiest ways to actually identify this is just to sit down with everybody in an organization and ask, what do you do every day? What do you do periodically? What are the things that if you didn't do them, something bad would happen, right? And it's often things we don't think about that turn out to be really important. Particular reports that are due, particular little things of administrivia, sometimes actually matter a lot. And sometimes it's not that difficult to do them from elsewhere or have somebody else do them. Another reason for this is because in small organizations, I know many small social profit organizations are one serious illness away from a very big continuity problem. If somebody who really is a holder of knowledge, institutional knowledge in that organization, is out, is unreachable, is unavailable for a prolonged period of time, it can be very difficult for someone else to reconstruct what they do. We tend to rely more on knowledge than on handbooks. That's not always the case, and I know a lot of social profit organizations are part of larger national groups, and so then you are perhaps getting some structures and things put in place that way. But there are also still a lot of organizations where certain parts of their operations are informal, for lack of a better word. We'll also talk a little bit about maintaining information on contacts who do you really need to be able to reach, both internally and externally in a disaster. Looking at technology, equipment, and data management, looking at finances. And then that sort of takes us through the bulk of these questions. This kind of exercise can also look in a lot more detail at other areas of operations. Think, for example, supply chains. If you depend on other organizations for transportation, for materials, right, then whatever happens with them is also going to impact what services you can provide. If you're in a network of similar organizations, if some portion of them, of the other organizations go down, the needs that come to you might be much higher, right? So there are a lot of other things to think about here. And this is, again, another reason not to do this in a vacuum. Some of what's in here, you're probably not going to want to share with other organizations, but some pieces are worth discussing. As one final example, if a lot of organizations are relying on the same contractor for basic services after a disaster, right? That contractor may be stretched too thin. There are a lot of other considerations there as well. So the types of questions that you want to ask when it comes to your key tasks and functions, first, right? What are these important tasks? What are the things that really need to be happening? Who's responsible for them? Are there deadlines? How often is that task needed? Are there particular functions that you can perform after a disaster to assist with disaster recovery? So are there particular functions that can be pre-assigned for sort of internal to the organization? Who's going to manage grants? Who's going to file insurance claims, right? Who's going to survey impacted populations to see how needs have or haven't changed? Who's going to contact your funders if you're going to have to miss deadlines? Who's going to attend recovery meetings if you want to be involved with municipal level planning? Right? And are there additional services that maybe you want to provide that are related to what you already provide, right? I think COVID-19 showed that for a lot of organizations. A lot of organizations expanded some of their services or slightly changed their service models as a result of the unique needs that the pandemic brought up. And if key tasks are tied to a specific site, are those facilities protected, right? And if they're not, do you have alternative facilities identified? Do you have agreements in place to be able to use another site? Can everybody actually work remotely, right? All of these questions. For the key contacts, this involves really being certain that you have at hand good contact information for everybody that you're going to need to be in touch with in a disaster. And so that's certainly directors, leadership, employees, volunteers. There's two reasons for this. I mean, the first is really just to know, right, who's still going to be able to meet their job functions, when are they coming back? It can also be to provide support, right? What do people need, and can you help connect them to those resources? Are there particular resources, including knowledge or experience, right? Particular skill sets that some of your employees or your volunteers can provide. If you have volunteers that are retired persons, do you know what they did previously? Right? What are those resources that you have at hand? What are the connections that you have at hand? And how much of that can you figure out on the front end? And also, you know, if you can't find somebody, do you have somebody else that you can reach out to? Have they shared secondary contact information, and has that been updated? We do have a tendency to sort of gather some of this once in some kind of intake process, and then a person might be with the organization for 5 or 6 years, and in that time they may have moved, they may have changed phone numbers, right? And then you have external contacts. Do you have a means to still continue doing your work, right? Can you reach the populations that you serve? Are there other agencies that you need to still be able to interact with that may not be functioning in their normal ways? And so you may need alternative contact information. You may need other ways to reach out to them. You may even need alternative groups to have contracts with. This is a good space for collaboration, right? If you're using similar things, then you can talk to each other to find out which suppliers or vendors are available or are not. And technology, equipment, and data. This is another one that I think is sometimes very daunting, because this includes really thinking about electronic records and how they're kept. It's gotten much easier to do cloud-based backup now, and that certainly has a lot of advantages for not permanently losing information. But cloud-based systems depend on access to the cloud. Right? And so unless you're able to evacuate to some place where you're going to have consistent internet access, if you have a reduction in cell service, if you have a loss of internet access, that data is safe, but that data is not at your hands, right? So if there is information contained in electronic records that you really need to access more frequently, it doesn't hurt to actually have a physical backup as well, to actually have a folder of some important papers or things that you're going to take with you, but also be cognizant that you have to, of course, take steps to protect certain kinds of data. So you want to be sure that your plans don't put data at risk. Are there historic records or other documents that are purely physical? This is much less the case now than it was maybe 10 years ago, but some organizations do still have documents that they haven't had the time to archive, haven't had the time to scan. Also, do you own any equipment? Are there pieces of equipment that are necessary to your mission? Do you have the information at hand in an inventory, for example, to really be able to file for an insurance claim, right? Is there any equipment that it makes sense to actually remove in the event of an evacuation? And this gets a little more complicated because it adds time, it adds cost sometimes, So generally speaking, you want to avoid packing the whole office and taking it with you. But there certainly are circumstances in which there may be certain key things that are mobile and that it makes sense to try to figure out a way to take them. Another thing here is when you have individuals who are using computers, for example, right? Many organizations have now moved to laptops. Having policies in place where certain times of year when risks are higher, maybe employees take those home with them in the evening, don't leave them in the office. Those can be the kinds of things to consider here as well. And then finances. This is also rather challenging for some folks. It's really knowing the accounts that you have. It's knowing how to access them. Right? Oftentimes you have a very limited group of individuals in an organization that has passwords, has access. Can you have alternatives for an emergency? Can you still manage things like payroll? If you're relying on local companies, local banks, for example, are you still going to be able to access your resources if that bank is impacted? And insurance as well, is somebody looking at insurance policies every year because they change, the riders on them change. Business interruption policies, for example, cover different things now than they did 5 or 6 years ago because insurance companies learned from their experience with large events. There are terrorism riders on a lot of policies after 9/11. Okay? And so it is very often the case that an insurance policy does not actually cover everything that an organization hopes it would. And that can be very problematic as well. So I know that was a really quick speed race through a lot of questions. So if there are questions on that, in a few minutes, I'll kind of open it up for questions. And I'm happy to share more information if folks want it, and hopefully you'll attend that workshop later on. As some additional considerations, I mentioned this earlier, but the importance of supporting staff and volunteers, not just during an event, but sharing information on preparedness, helping people to perhaps have a day where folks can digitize their own records, right? Inviting others in to come talk to staff about things that they can do for their own properties, for example. You can also support the populations that you serve, again, by being a conduit for information and resources. There are often emergent organizations that arise after a disaster, and sometimes they stick around and sometimes they don't, right? Sometimes the need is met, an organization stays pretty informal and dissolves when the need seems to have passed. At other times, those organizations become more institutionalized and become part of the social profit landscape. And so really looking for ways to engage with these emergent institutions, some of which may not want to engage with more formally established organizations, but they can be a good partner to really sort of understand where there are needs, perhaps to direct individuals to when there are needs that you can't meet. Another consideration is mission creep. It is certainly the case that what you're doing on a day-to-day basis might need to change in response to a disaster or an emergency. And that may still be in alignment with the larger mission of the organization. But recovery can take, as you know, recovery can take a really long time. How long do you have sort of a slightly modified mission? I'm so sorry. It looks like it kicked me out for a moment. Are you able to hear me again?
Yeah, I can hear you.
Okay. I'm not sure what happened. I hope that wasn't a long interruption. What I was going to say with long-term strategic planning, though, is that there are opportunities to budget for some of these things, right? To think over time about how you can change processes, make investments that can reduce disaster risk. And part of that is thinking about hazard mitigation. And you have resources and tools available. I share, for example, this graphic from FireSmart. It is geared at homeowners, but a lot of these principles apply to other structures. And there are also measures that can be taken for flooding and for other events as well. I'm sharing here a list of resources. You may already be familiar with these, but I did want to share these with you if you're not. And one thing that you can also do in terms of collaboration is to continue to share resources and take a list like this and just keep expanding it and let it live in a shared space where folks can access it. And with that, I think I'll stop sharing and open up for questions. I would welcome any questions or comments in the chat. I see a question about capacity building since Katrina. Can I speak to what has changed from Ida? From the perspective of the nonprofit sector, there's been a really interesting trajectory since Hurricane Katrina. Hurricane Katrina took a tremendous toll on organizations in Louisiana, especially, I think, trauma to staff who were themselves impacted and trying to be supportive of populations. And so a lot of our actual coordinating structures, like the voluntary organizations active in disasters, sort of fell apart after Hurricane Katrina. Not in the immediate aftermath, but 4, 5, 6 years later, there was a lot of exhaustion, there was a lot of trauma, there was a lot of turnover. And it took several years to really build that capacity back up. And in fact, last year, Hurricane Laura which hit Southwest Louisiana, but brought about 6,000 to 7,000 evacuees to the New Orleans area, was really the event that sort of revitalized some of that nonprofit sector. And so it was interesting to see the effects of that kind of trauma on organizations. And with Hurricane Ida, much of the impacts are further down along the coast, so about an hour and a half south of the city in much more rural areas where you have older Cajun populations and you have indigenous peoples. And in those communities, there are some local organizations that are characterized as nonprofits, but they're in sort of an interesting space because in a way they're nonprofits because of their mission, but in a much larger sense, they're nonprofits because it's the only sort of formal government recognition that some of these tribes can get because they're not federally recognized. And so they operate sort of as a strange mix of a quasi-sovereign entity and a nonprofit organization. And they were really strained to the limit, but also, I think, had a lot of relationships and network building that had happened, including with people from pretty far away. So I'll give you one example for collaboration. A lot of the small indigenous communities in Louisiana collaborated with small indigenous communities in Alaska following the Deepwater Horizon, the oil spill in 2010, because there's actually a ton of similarity in the impacts to the coasts, in the oil and gas industry. And so they work together almost immediately. Are there any other questions or comments? I see a hand, Julie.
Julie, if you'd like to unmute to speak, you're welcome to do that.
Not sure if there's another Julie. I do have my hand up. Sorry, just moved the phone and accidentally tapped that button. But thanks for the presentation. It was lots of valuable information.
Thank you. You know, I would definitely be curious to hear from folks sort of how your thinking is or isn't changing around disaster risk reduction as you're engaging in these conversations. If it's feeling more or less manageable, I think there's sort of a risk of either outcome. See a good comment. So those involved with the 2016 fires had to reactivate for 2020 floods and recognize what they had learned now to resist capture. Okay. You know, I think this also speaks to the idea of sort of what we do with what we learn. In emergency management, there are often these sort of very formal lessons learned kind of processes where people come together and they try to figure out what worked, what didn't work, and then that sits on a shelf somewhere in a report. It doesn't tend to actually lead to a lot of change. But that process of essentially debriefing is a very useful one. And sometimes in the social profit sector, because we hop from one crisis to another, or because we just can't seem to get out of crisis with COVID and everything else, it's hard to make that space. And somebody can come from the outside, like myself, and I can give you ideas that may or may not be helpful, but I'm not there. I don't sit in your shoes, right? And you probably have just as much to contribute to each other as somebody could bring you from the outside. And so I think having that opportunity to talk about what has been successful and what has not really is very useful. And I hope that you are able to have some discussion and reflection, you know, outside of just when someone's here. I see another question. For social profits that are thinking about getting started with building more formal continuity plans, where do you think is the most valuable area of planning to start? There are a few schools of thought on this. And so I'm going to give you two alternatives that I would sort of throw out there. The first is start where you're most likely to be able to start. What piece of continuity do you already have maybe a little bit of momentum for, maybe support for among staff, right? Do you have somebody that's already raised the question of, oh, I don't think I could work from home if I needed to. Now with COVID, that's probably not the case, but is there a particular need that's become very clear? Is there a champion in the organization that really is concerned about one of these pieces, right? Is there something that a lot of neighboring organizations are working on? Sometimes you can start there, right? For example, if a few folks are looking at their insurance and whether or not it does in fact cover everything that you'd like it to cover, right? Is it possible to come together with some folks with experience and have almost a workshop, right? Where you can review your plans, your insurance policies, and find gaps. So sometimes I really think the best answer is start where you can. I know that sounds like a non-answer, but we sometimes will try to start in the best place, right? We try to do it the right way, and we miss out on doing what we actually can, and we lose a window. The other part of that answer, maybe more the official or sort of better answer, is that I think starting from really understanding what it is that you do and who it is that you serve is very important, right? Because then you can ask, okay, how can these things we do be impacted by these hazards, right? And what can we do about it? How can the people we serve be impacted by these hazards? And what can we do about it? And how will that impact us? But you have to start from that baseline. And we assume we know, but we don't always, right? Because we don't always look at it through this lens of disasters. And so starting with these very basic, even just conversations, right, with staff leadership, what exactly are we doing? It can be part of strategic planning, right? Is it that we're trying to be doing? Are there other questions?
I just wanted to acknowledge how much your presentation has kind of meant to the planning team. We've been, yeah, just so many really great ideas that we'll take forward and inform the future work that we do in this project. And I know that we've recorded this, so there are many people that are maybe not able to attend today, but that we will share with as well. It's you've been so on point, and thank you so much for coming. I'll turn it over to Shauna.
Yeah, I just want to echo that too. Thank you so much for presenting today. It was really insightful. I do just want to say that we will be sending out an evaluation survey at the end of the session. You will see that in your inbox maybe in an hour or so. So I just wanted to say that that is a confidential survey for you to add your comments, even further questions, maybe some ideas for the future based on today's presentation. So I'd like to thank everybody for coming, and we hope to see you at the series, part 3 of the series. So thanks.
Elsa, how many were there?
Hi, Shauna. Are you still there?
Yeah, I'm still here.
Oh, that was so good.
Yes, that went really well.
Yeah, you're still recording.